The CECC partially lifted its ban on hospital visitation on Tuesday, as it announced just one new local COVID case. Visits are now allowed for patients in ICUs, hospice wards, respiratory care wards, psychiatric wards, and pediatric wards. They're also allowed for terminally ill patients as well as people with disabilities.
Patients can have up to 2 visitors at a time during a designated period of the day. Visitors will need to provide proof of a negative rapid or PCR test taken within 3 days of their visit. Let's hear from the health minister.
基本上我们从今天起，8月24号起，对特定病房的探病。
Basically, starting today, August 24th, visitor restrictions are lifted on designated wards. These are intensive care units, hospice wards, respiratory care wards, psychiatric wards, and children's wards. Visits will also open up for people with disabilities and for terminally ill patients. Visiting times will be the same. There will be a designated time. There can be up to 2 visitors at a time for hospitalized patients, and they'll need to provide proof of a negative antigen or PCR test taken in the previous 3 days. That includes home testing kits. They need to show proof of a negative test. People who have been fully vaccinated with 2 doses at least 14 days before the visit don't need to show proof of a test. The requirement is also waived for people who were diagnosed with COVID but met the conditions for release from isolation after testing negative if they experienced the onset of symptoms less than 3 months ago.
But the CECC is tightening rules at the border to keep out the Delta COVID strain. Starting August 27th, international arrivals will no longer be allowed to drive their own vehicles from the airport to quarantine facilities. They will all have to take government designated transport to lower the risk of viral transmission.